Welcome to the Spine Center at Piedmont Atlanta Hospital, one of the nation's top centers of care for spinal disorders and surgeries. Our unique, patient-focused approach offers you one of Georgia's largest teams of preeminent physicians, a highly trained and compassionate clinical staff, state-of-the-art support services, and the most advanced technologies. It is our team's mission and privilege to make sure your surgery experience is positive and your recovery successful. In fact, your comfort and your healing are our most critical priorities. Now that you and your doctor have made the decision to go forward with your spine surgery, we understand you may be feeling a range of emotions and have a number of questions. Here at the Piedmont Spine Center, we believe an educated patient is an empowered patient. That's why we consider you a vital member of our healthcare team. We encourage you to become an active participant in your own well-being, learning all you can about your condition, your surgery, and your plan for recovery.
It's a great program, and I think a little unusual in the fact that we focus so much on preoperative education, preparation, informing and empowering the patient so that they are more knowledgeable and more prepared to participate with their own recovery.
This video guide is designed to supplement the printed materials you'll receive, including your spine surgery education guide and your surgery-specific guide, which maps your treatment plan for your particular type of surgery. We call your specific plan of care a pathway to healing. Your pathway is the day-by-day series of events before, during, and after your surgery that are nationally recognized and proven steps to put you on the best possible road to recovery. As with your printed spine surgery guides, this video presentation will explain the three main phases of your treatment experience. Phase 1 is before your surgery. We'll let you know what you need to do to prepare for your operation. Phase 2 is the day of surgery. We'll walk you through the steps from the time you arrive at the hospital until you're resting in your hospital room. Phase 3 is after your surgery. We'll tell you what to expect during your hospital stay, after you are discharged, and while you continue to recover at home. There are a number of preparations to make before you have your surgery, and one of the things we suggest you do is designate someone to be your spine coach.
And this is really an individual who will not only support the patient, but also be a little more strict when the patient needs some encouragement, such as walking so many times a day after surgery. And the spine coach really can be a family member, a friend, spouse, whomever they determine is most appropriate.
Another early step on your pathway to healing is to register for our free preoperative spine surgery class. You can sign up for the class online at piedmontspinecenter.org or by calling 404-605-2372.
All right, this is your lumbar spine. So here are your vertebrae.
This preoperative spine surgery class is not mandatory, but we encourage our patients, family members, and spine coaches to attend. It's your chance to get more in-depth information about preparations and precautions regarding your surgery experience.
This is purely supplemental oxygen while you're waking up from the anesthesia.
In this preoperative class, you'll learn details about the best ways to get yourself, your family, and your home ready for your surgery. We'll show you certain medical devices and techniques that will likely be used in your care while you're in the hospital. We will emphasize the importance of using proper body mechanics after your operation to help facilitate your recovery and promote general spine wellness.
So the precautions, we like to say BLT, like the sandwich. So no bending, lifting, or twisting.
As you'll also learn in the class, it's a great idea to prepare your home ahead of time so that it's a safe, accessible, and comfortable environment for your return after surgery. Consider stocking up on meals and food items that will be easy to prepare and that fit into any dietary considerations your surgeon gives you. Reposition food from the lower part of your refrigerator to an upper shelf so you can reach it without bending too much. The same thing goes for items stored up high. Move them to a lower, more accessible place so you don't have to stretch to reach them. On the bed you'll sleep in when you come home after your surgery, make sure you have plenty of extra pillows to use for support and positioning. Use your proper body mechanics diagram that's in your spine surgery education packet to practice getting in and out of bed, up and down in a chair, and other activities using spinal precautions. You can also see video demonstrations of proper body mechanics on our website, PiedmontSpineCenter.org. You'll want to have plenty of loose, comfortable clothing items ready to wear during your recovery at home. In the bathroom, items you'll need daily that are normally stored away need to be made accessible. Put extra towels where you can easily reach them. And to avoid bending or twisting your spine, use a long handle brush for showering. Consider arranging for someone to help you during and after your hospital stay with household and family tasks, such as childcare, pet care, house cleaning, yard work, grocery shopping, and transportation to and from your appointments. Once your surgery is scheduled, your surgeon's office will arrange an appointment for you to visit the ATA, that's the admissions testing area at Piedmont Atlanta Hospital. This appointment will usually take place 4 to 7 days before your surgery.
Good morning, sir.
Morning.
Just follow me on back, please.
In the ATA, you will have a thorough health assessment that may include tests to make sure you are medically clear to undergo surgery. A nurse will ask you questions about your medical history and about any medications you are taking. She will examine you, checking your blood pressure, taking some blood samples, and in general, gathering important information about your health. All of this information will be compiled in your medical record so that each member of your surgical team can review it prior to your surgery. The ATA nurse will also share with you some critical information, including specific instructions about what not to eat and drink immediately before your surgery, which of your medications you need to stop taking, and which ones are okay to take with a sip of water on the morning of your surgery.
So place one hand here and one hand there.
Another medical professional you'll meet in the ATA is a respiratory therapist. The respiratory therapist will teach you how to use your incentive spirometer. That's a device you will use after your surgery to help keep your lungs clear.
Keeping the blue ball in between the arrows the entire time. Very good, good job.
You'll do these breathing exercises several times a day during your recovery to keep your lungs active until you can return to your daily activities. Also, on the day of your ATA appointment, you will meet with a hospital representative who will pre-register you for your surgery and hospital stay and help to make sure all of your paperwork is in order. You'll find more detailed information about how to prepare for your spine surgery in your printed spine surgery patient education guides, including a checklist of what to bring to the hospital the day of your surgery. When you arrive at the hospital the morning of your surgery, you'll check in at the admissions desk and then go to the surgical waiting area. This is where friends and family will wait while you're in surgery. Some important reminders for that morning. Don't have anything to eat or drink after midnight the night before your surgery. Leave jewelry and all valuables at home or with a family member. Bring your ID and insurance or payment information. Bring a container for contact lenses, glasses, or removable dental work. Don't wear any hairpins, makeup, perfume, or cologne.
Michael, I'm Janice. We're going to be getting you ready in here. We're in room 1.
In the pre-op or AM surgery area, a nurse will make sure you are prepared for your surgery and answer any questions you may have. She's going to ask you to remove your clothing and change into a hospital gown, putting your own clothes into a personal belongings bag. Here are some other items you'll be asked to remove: dentures and bridges, hearing aids, contact lenses and glasses, body piercings and jewelry, wigs, hairpins, combs, and barrettes.
Michael, can I come in now?
Yes, you can.
Okay.
When you have changed and are ready, your nurse will return and begin checking your vital signs. These tests will include checking your blood pressure and your blood oxygen levels, and taking your temperature. Because patient safety is our main priority, the nurse will also be confirming with you what kind of surgery you're having and on what side of your body are your symptoms. The nurse will be placing a needle into your vein in your arm or wrist. The needle will be attached to a tube called an intravenous line, or IV, and it will be supplying your body with fluids, medications, or blood during and after your surgery. You'll also get non-skid socks for your feet and a blanket to keep you comfortable. After your anesthesiologist and surgeon have seen you and the surgical team is ready for you, you will be taken on a stretcher to the operating room. When you arrive in the OR, the anesthesia team will attach monitors to your body, and then, after you're asleep, a catheter may be placed in your bladder to drain urine, and sequential compression wraps put around your legs to reduce the risk of blood clots. The length of time you'll be in surgery will depend on your condition and the type of surgery you are having. Your surgeon is the best person to give you an estimated amount of time you'll be in the operating room.
Hey, welcome to recovery. I'm Shannon, I'll be your nurse. What's your name?
When your surgery is over, you will typically wake up in the post-anesthesia care unit, or PACU. The nurses in this recovery room area are specially trained to care for and closely monitor patients after surgery. You may be groggy, but your PACU nurse will ask you questions about how you are feeling and attach monitors to you in order to check your vital signs, including your heart rate, blood pressure, and blood oxygen levels.
So if you can do me a favor and actually bend up this right knee.
To make sure your incision site or bandage is intact, the nurse will help you to gently roll to your side so she can get a clear look. While you're in the recovery room, your surgeon will talk with your family in the waiting room, briefing them on your surgery and your status in recovery. Your family will be notified when you are in your own hospital room and are ready for visitors. Depending on the type of surgery you have and your status, you can expect to stay in the PACU recovery area for 1 to 2 hours. When you are fully awake and your vital signs are stable, you will be transferred to your hospital room, unless you are going home from the recovery room. If you are having outpatient surgery, when it's time to go home, you will be given specific discharge instructions and prescriptions for your medications. You must have someone to drive you home. If for any reason your doctor feels you should stay in the hospital overnight, Piedmont Atlanta Hospital does offer observation care.
At a time where the patient may feel anxious, afraid, overwhelmed by everything that is happening, we are here to help the patient throughout that experience.
My name is Virginia. I'm going to be your clinical partner for today.
When you are settled in your hospital room, you can expect us to frequently assess your vital signs, blood pressure, heart rate, respiratory rate, and temperature. Your nurses will also repeatedly ask you if you're experiencing any pain, muscle spasms, numbness, tingling, or weakness. These are serious questions that your surgeon is depending on us to ask. Some other considerations your doctor and other team members will discuss with you while you're in the hospital include pain control. We will frequently assess your pain level and administer medication prescribed to manage the pain. Medications. We'll talk about when you can resume taking the medications you routinely take at home and whether you need something for nausea, vomiting, constipation, or muscle spasms. Drains. Depending on your type of surgery, you may have a drain adjacent to your surgical incision. The drain promotes healing by draining fluid away from the surgical site. It is often removed the day after surgery, but may remain in place an additional day or two based on your surgeon's orders. You can refer to your surgery-specific guide or pathway to healing for information about possible treatments and equipment you should expect during your hospital stay. Depending on your type of surgery, you will probably be offered a clear liquid diet, at least at first. As you recover, your menu will be based on how well you are tolerating your meals, plus any other doctor's orders. Your doctor will also be deciding what activity is appropriate for you, whether it's bed rest only, may get up for the bathroom only, or may walk as tolerated. Moving about, but only as instructed, will help prevent complications and encourage your recovery. For your safety, get out of bed or walk only with a staff member until you are cleared to do so by yourself.
Blow out, place it in your mouth, and slowly suck in, keeping the ball in between the arrows the entire time.
Another way to prevent complications is to use your incentive spirometer. Doing these deep breathing exercises while you're in the hospital will open your airways to help prevent pneumonia after surgery. You will also continue to wear compression devices around your legs. Again, these items are designed to help minimize the risk of blood clots.
We want all of our patients and families to know that we are here as a team to identify and coordinate any service that they may need to optimize their recovery from a procedure or from a hospital stay.
All right, how we're gonna get up out of the bed is log roll technique.
In some cases on the same day as your surgery, but often on the day after your surgery, also known as post-op day number 1, your surgeon may direct a physical therapist to assess your mobility and strength, instruct you on proper body mechanics, and show you ways to protect your spine.
We're gonna use this walker the first time you get up.
You will be walking at least 2 or 3 times a day while you're in the hospital, always with a physical therapist or other staff member. Some spine surgery patients remain in the hospital for a few days, but for many people, this post-op day number 1 is also the day you were discharged.
Hi there, I'm Cindy. I'm your case manager.
On the day you were being discharged from the hospital, or sooner in some cases, your case manager or patient care coordinator will help you make arrangements for any home equipment or services your doctor recommends. She can also coordinate rehab facility care and continued physical therapy sessions. If you need help with activities of daily living or ADLs, your doctor may recommend an evaluation by an occupational therapist. Occupational therapy focuses on restoring your ability to perform self-care tasks and often includes the use of devices that help you do those daily chores while still keeping your spine safe.
Activities of daily living, that's dressing, that's bathing, that's, your hair care. So our job is to try to teach people how to compensate and do it in a different way so that when they are healing, they aren't disrupting that process.
Hi, Michael. So I'm discharging you home. I've got some information for you, okay?
At your doctor's orders, your nurse will give you printed discharge instructions to guide your recovery at home, including when to return to your doctor's office for a post-op appointment, information about your medications and your diet, and specific guidelines for what activities and exercise you can do. Your surgeon may also ask a nurse to change your bandage and give you instructions about wound care before you leave the hospital. When it's time to leave the hospital, remember you must have someone to drive you, preferably in a vehicle you can easily get in and out of, without extreme bending or twisting of the spine. Wear comfortable clothes for the journey home and take all of your valuables with you along with your discharge instructions and your incentive spirometer. Hopefully you will have prepared your home before you had your surgery so that your environment is safe, comfortable, and convenient during your recovery. At home, continue using the correct body mechanics and spine precautions that you learned in the hospital. Don't lift more than about 10 pounds until cleared by your surgeon. If you're a lumbar surgery patient, try to maintain a neutral spine. Avoid extreme or repetitive twisting or bending at your waist. This helps to minimize discomfort and protect the surgical area. If you're a neck surgery patient, try to maintain a neutral spine. Avoid extreme or repetitive twisting or bending of your neck. This helps to minimize discomfort and protect the surgical area. If you have a brace or a collar, wear it as directed by your surgeon. Don't run, lift weights, or play any kind of sport until cleared by your doctor. If your surgeon and physical therapist determine that you would benefit from more physical therapy after you go home, appointments can be made for you at the Piedmont Outpatient Physical Therapy Clinic. Depending on your type of surgery and condition, your doctor may clear you for sex, usually 2 to 4 weeks after your operation. A brochure containing additional information is available in the Spine Center. And don't forget to sign up to receive the Spine Center's helpful emails, sent to you once a week during the 2 months following your surgery.
Initially, the topics will address the more acute concerns associated with recovery, such as wound care or follow-up with the physician, or when they can resume driving or other specific activities. And as the emails progress throughout that whole recovery process, it may evolve to where it's addressing smoking cessation or specific exercises or activities that are spine-friendly.
The best spine-friendly exercise is walking, taking it slow and easy at first, gradually building up your endurance and distance. Along with your lifestyle modifications, an essential component of your spine health continuum of care is the Piedmont Atlanta Health and Fitness Center. This facility offers a variety of spine-friendly activities led by professionals who know how to guide spine surgery patients in improving their overall health. For example, the 25-yard therapy pool is an excellent place for spine surgery patients to exercise and rejuvenate. It is our hope at the Piedmont Spine Center that your spine surgery journey is a positive experience. Our team's promise and pleasure is to be with you every step of the way on your pathway to healing, to help to restore your spine health, get you back to your daily routine and to your family, back to enjoying your life.